Hello, I am Joyce Harper and I am Professor of Reproductive Science at the Institute for Women's Health at University College London. My latest book, Your Fertile Years, will be out in April 2021, published by Sheldon Press and available now to pre-order on Amazon. Each week I'm writing a blog and making a video for each chapter of the book. And this video is about chapter 7, what you should know about pregnancy and childbirth. The World Health Organization defines a positive pregnancy experience as maintaining physical and socio-cultural normality, maintaining a healthy pregnancy for mother and baby, including preventing and treating risks, illness, and death, having an effective transition to positive labor and birth, and achieving positive motherhood, including maternal self-esteem, competence, and autonomy. I apologize for this very busy slide, which I normally try to avoid, but I just want to show you all the different things that I cover in this chapter. So in this video, I am just going to touch on a few of these really important topics. And the first is preconception care. Preconception care is the preparation a man and a woman should take before trying for a baby. And chances are you've never been told about what you need to do to increase the chance of becoming pregnant and having a healthy pregnancy, birth, and child. So if you are trying to get pregnant or thinking about it, I would really advise you to go to your GP and see your nurse practitioner and hopefully have some really useful conversations around preconception care. It's really important for the man and the woman to be balancing their pillars of well-being. And these are nutrition, exercise, sleep, and mental health. And I went through this in chapter 3 of my book. Men and women need to avoid the obvious, such as alcohol, caffeine, smoking, and also some medications and occupational hazards. Going back to the well-being, pillar of well-being of weight and nutrition, it's really important that both the man and the woman have a normal BMI. There is a lot of evidence that ensuring this preconception care is optional will help people become pregnant and have a healthy pregnancy and birth, but also that if these are not being looked after by the prospective parents, they can affect the long-term health of the future child. So this is something that there's been a lot of research and discussion about in recent years. And there is this excellent book, Preconception, Health and Care, a life course approach, where they discuss the importance of the man and the woman's health, especially with regards to the long-term health of the future child. Now, I spent a lot of years studying genetics, so I wanted to also talk to you about genetic tests before you start trying to get pregnant. We all carry errors in our DNA, in our chromosomes, and they can be inherited in different ways. A recessive disease is where, to be affected by it, you've got to have both of the genes from your mother and your father to have an abnormality or a mutation or an error. A dominant disease just needs one abnormal copy of the gene. So these are often late onset disorders that you only need one faulty gene and you may get this abnormality. And then there are sex-linked diseases which are carried by the mother and they can be transmitted to her son. She will most likely have a normal X chromosome and one that has the error. And if her son inherits the gene that has the error, then he can be affected with the disease. So there are many couples that may know they are at risk because they may have had family members affected or they may have done some genetic tests. But there are a lot of births every year where the couple didn't know. As I said, we all carry something. It's just whether our partner carries the same error as we do for a recessive disorder. And there's a new technique called expanded carrier screening that couples can take before they have a child. And these panels of genes that are looked at on expanded carrier screening, depending what panels use, they can look for hundreds of different genes, and the male and female are looked at together. and they can tell whether there's any risk for them to transmit the diseases on the panel to their future children. So this is something that's being done quite a lot in the USA, and the studies have found that about 2% of couples, so it's very low, but 2% of couples did not know they were at risk of transmitting a particular genetic disease to their child that was discovered by expanded carrier screening. So some people might feel that that's a very low risk, but if you did have an affected child, that obviously would lead to many issues for that family. Then we've got non-invasive and invasive prenatal diagnosis. So non-invasive prenatal diagnosis is a relatively new procedure where we just take some of the mother's blood and we can have a look at the blood to see if the fetus is carrying the abnormality. Because of the risk of also looking at the mother's blood at the same time, this actually only works at the moment effectively if we're looking for a dominant disease or for a mutation in a gene that the mother doesn't carry. So that's a little bit of complicated genetics, but it's just to say it is a developing procedure. Amniocentesis is a very well-established procedure. It's been around for many, many years. And this is where we take some of the amniotic fluid from around the baby, as shown in the middle diagram, and it's done about 16 weeks of pregnancy. And chorionic villus sampling is done about 10 to 12 weeks, and this is where we take a biopsy of some of the placenta and use that for our genetic testing. Now, all three of these methods can be used if a couple know they're at risk of transmitting a particular genetic disease to their child. But if they're not at risk, then they wouldn't have these procedures done. They also might not know they're at risk, but they might have had some abnormality picked up during ultrasound or by another test that has led them to have one of these tests. But these tests are diagnostic tests that are used to check whether the developing embryo is carrying a genetic or chromosomal abnormality. Another new test is non-invasive prenatal testing. This is very similar to non-invasive prenatal diagnosis, but this is a test that's being offered in many countries now to all pregnant women. And this is a test not looking for inherited disease, but this is checking the chromosomes of the woman. So in previous talks, I've mentioned that as a woman ages, there's an increased risk of her chromosomes becoming abnormal. And this is called age-related aneuploidy. And aneuploidy is where we have missing or extra chromosomes within the developing fetus or in the person. So this can affect any woman of any age, but there's more risk as she gets older. Up until the development of NIPT, women used to have an ultrasound scan, and they used to have something called serum screening, where we used to look at markers that gave us an indication that there might be an extra chromosome. NIPT is a genetic test. It's looking in the blood of the woman to look at the chromosomes, especially for chromosome 21. So it's non-invasive because it's just a blood sample. There's no needles that go near the embryo, the developing fetus or embryo at any time. So it's a test that can be offered to all women, and this will give us some indication of whether there is anything wrong with the chromosomes in the developing fetus. So that's a real whistle-stop tour of chapter 7. I've only covered a few of the topics that I will go into in chapter 7 in the book. You can find a little bit more information in the blog, which is on globalwomenconnected.com, what you should know about pregnancy and childbirth. Thank you very much.